So it's very good to do home monitoring, because there's some persons who they get nervous when they go into the doctor's office, or even just to see the clinic, they would get nervous. So home monitoring is something that we do advise, not only for persons who are hypertensive, but also for the persons who may be at risk for developing hypertension. Now, in terms of taking your blood pressure at home, the first thing that I would advise you is to make sure that you have a monitor or a device that is it's working properly, right? So that's the first thing that you need to be sure of. And one of the things that you can do is to have the reading done at home, and then have it done in a setting where there is a monitor that is already calibrated, or a monitor that we are sure of the results. Now, in terms of taking the reading at home, first of all, for 30 minutes before taking the reading, you should be at rest. So that will be sitting. So you don't want to take the reading as soon as you're finished taking some exercise or walking. And also, if you've just finished eating, also alcohol and caffeine use, at least 30 minutes before the reading, you shouldn't have those. So you're in a sitting position, and then you have your cuff. Remember, you have to have the right size of cuff. Usually, I recommend, if you have one of those devices where you can take the blood pressure from the arm and not the wrist. It's okay to take it at the wrist, but it's more accurate if you have one that would take at the arm. So you have your cuff on, and then you have to make sure that it's positioned correctly. Once it's positioned correctly and it's on the bare skin, not over the clothes, then you make sure that it's at the level of the heart. So sometimes you might need to put a cushion under the arm to bring it to the level of the heart. The other thing that you want to ensure is that your bladder, so you don't need to pee, it's empty, because that can also alter your reading. And you're going to sit quietly, not talking, during your reading. So once that is done, then you can have that repeated 2 or 3 times, so we can get an average of what your actual reading would be.